Wonderful. All right, you've got Chris Nicholson here. Hope everyone is doing well today. Thank you so much for having us. I'd like to dive in and starting actually with one of the quotes that I actually read in the Louisiana Health Equity Plan that I thought was really powerful, which is that community engagement has positive impact on a range of health outcomes. And today what I want to do is talk to you about the brief, talk to you about the learnings and how we listen to consumers to drive engagement and ultimately drive outcomes, but doing that with the lens to really support and engage these underserved and marginalized populations. And so we'll do that to support this at a community level and really share that approach. As I start out with this conversation, we want to go into a couple of things really to understand mPulse and why we were founded. And so one of our core investors at the beginning, as we launched the company about 6 years ago, was the California Healthcare Foundation. The foundation, I think, recognized the value and approach that we had to engaging these populations that, as were just mentioned in the last question, hard to reach, hard to engage, or sometimes those considered the unreachables. And so we were founded to improve the way that healthcare engages all members, increase reach and access for all members, to improve health outcomes for all members, and really develop these innovative engagement solutions. And so as we talk about the brief and we talk about the innovation challenge, we're going to hit on these points and show you how we match each one of those capabilities. And so a little bit more on who we are is that our mission is to improve health equity and outcomes for the populations we serve. I'll get into the scale, I'll get into the different segments that we're working to support. And I think that you'll see that we truly have experience in managing and engaging these Medicaid populations through a multitude of channels and structures to support some really high value use cases for the teams. We're focused on reducing these health disparities for underserved populations. And we do that through access, we do that through information and insights and learning about the populations at a one-to-one level so we can actually tailor and build appropriate communications to serve these particular members. And then we do that by leveraging behavioral science, culturally relevant conversations, and actually that mix of tech-enabled services at scale. And we'll talk about why scale is so meaningful in this process as well. And so with that, everything happens and builds these meaningful conversations that drive actions, that improve outcomes, to engage these communities, and that builds trust, reduces confusion that was highlighted, improves outcomes, and creates insights. And I love the fact that you listened and you did research to actually get feedback from consumers around those experiences. I spent 15 years as the Chief Operating Officer for Humana's Population Health and Wellness team. We spent probably north of $150 million a year on outbound print. And then we spent 2 years and did ethnographic research to listen and to go into their homes and see what consumers were doing, what information was relevant, and bring that forward. And that was really the impetus for me to say, let's start this company because we know that we can do better in servicing and engaging these particular members and populations. And so who do we do that for, right? So we've got broad Medicaid and market experience. As you can see towards the center of the slide, the mix of Medicaid, Medicare, and individual. And we'll get into the scale across those of north of 20 million members that we're supporting Medicaid specifically for large partners like Centene, United Healthcare, Humana, and others, and those experiences. And then most importantly, I'll show the outcomes and the solutions that we're driving. But why I leave the other ones up around pharmacy and med supply and the behavioral health space is that those are critical needs that your particular members have as well. And the learnings and the insights that we get from engaging in these other parts of the healthcare ecosystem adds tremendous value to how we actually capture learning about the demographics and those social determinants of health and barriers that we're facing today. And so what are the solutions? And so when we look at the set of capabilities in our mPulse Medicaid solution suite, it's around things that are focused to get beneficiaries to take action. But I think as mentioned in the expert panel, was really not to sort of drive action or sort of drive it home. It's to create those relationships, create that trust around these multitude of solution areas. And so you can see here from redetermination, renewal, all of these different factors, around maternal health, well child, these are things that we've got experience in delivering capabilities. And again, outcomes in the way that we build those programs and solutions. And so focusing on enrollment, focusing on capabilities, and then most importantly, getting to the results. And so with that, a couple of things that we want to highlight is one of three use cases here. The first that I know is very relevant to the team is around prevention and screenings. This is core to the strategy for LDH is to improve care at all different levels based on these disparities. And so one of the programs, this was with Home State Health Plan, this was with Humana in their Medicaid population, was around breast cancer screenings and cervical. And so again, getting people to prevention, preventative screenings, driving up those completion rates, driving value and support. with some of the Centene plans around eligibility and enrollment focused on improving renewal and retention rates through redetermination, and then a 22 percentage point lift. And then what's really important about that, because I know one of the key questions that was in the feedback from the consumer information in the brief was that it was hard to get information from consumers. They were falling out, not filling out forms, not returning paperwork. And so this was leveraged to get 54% of respondents to actually complete information and documents from a two-way interactive dialogue over digital to capture information. And then lastly, but not least at all, because this is a tremendous, challenge within the state and within many states, is around well child and prevention. And again, getting people to those preventive screenings and immunizations at those early ages is so critical, and driving that value for this particular instance was home state health plan and driving success there. There was one question that came up actually during the Q&A. The last one was around community events. And actually we did partner with Illini Care to get people to events around enrollment and services, making them aware of public services, even then sending notifications around, food share and activities on the weekend that they could participate in as well. And so all that happens in this model, this sort of black box, again, from a technology perspective, this conversational AI that works to take segmentation, tailor these, from a cultural perspective, and then actually look at the response and engagement and build that model. And we'll show what is actually getting stored within that activation profile to drive these changes for you as well. So with that, one of the core premise of the research brief was omni-channel, was around the cadence, was around the frequency of messaging. And as you can see here, preference is really important, and you'll see sort of the dotted lines and the solid lines in the simple model. But we look at this across this digital experience holistically and in a truly orchestrated manner. And so when we're engaging around SMS or FTEU, which is free to end user, messaging that allows for no cost to the consumer to receive that information, is really, really effective for bearer identification and then again, getting access to these hard to reach populations. We leverage mobile web for rich communications and delivery. I'm going to highlight the next one, which is referred to as SMS 2.0, or rich business messaging and the dynamics that we can actually see and will actually be a driver for the future. Of course, email, drive to live agent through our engagement console and interactive, and then phone and outbound IVR. And so we really look at this as a two-way interactive dialogue versus just one-way or sort of campaign-based approaches in the market, and how we capture some really great data and insights. But one thing I'll mention here, because this came up multiple times in the brief, was that we allow the members to help set the frequency and the cadence. And so when we're engaging in a particular workflow or communication, we may ask that member an open-ended question and say, do you feel like we're engaging you enough? Do you feel like this information is helpful? Let's ask for feedback and let that drive the way that the dialogues actually move forward. And then as we jump in, the two that I wanted to highlight that I just think are truly innovative and I think will be things that we all look at in the marketplace. The one on the left, we leveraged photonovellas, which are image-based stories, and this concept of storytelling to really get broader access to a multitude of populations, and again, bring that literacy level down as low as we can to get the information that's necessary. And so you can see on the left-hand side, this one is specific to flu. We leverage this for prevention and education around COVID-19. During the sort of the height of the COVID pandemic, I think we delivered 80 to 90 million digital engagements focused specifically on COVID to get outreach to those populations that couldn't get to providers, that couldn't pick up medications, et cetera. So really, really innovative channel, great satisfaction and engagement across our Medicaid partners as well, and a multitude of storylines and use cases that we can leverage that. And then on the right, a newer capability from a channel perspective, which is this rich communication services, or again, SMS 2.0, allows for app-like features and capabilities inside of that device without the member ever having to download or engage. And so we don't have to send them off anymore to a mobile landing page. We don't have to go ask them to download, content. They can interact inside the messaging ecosystem that already exists on their devices. And we'll talk a little bit more about the access within your market to support that as well. So with that, let me go ahead and move on quickly. So in the activation intelligence space, we talked about scoring, we talked about prediction, and the way that we gather insights on a multitude of SDOH, barriers and factors. And so we learn about health status, we learn about screenings, we learn about states of change in the data that's actually coming back in real time. And I'll show you a pretty simple or fundamental example on how we can get some insights. But again, because voice of customer is so critical here, we'll show some live responses from individuals as well. So In this particular example, you can see that this is just a reminder to refill a particular medication for diabetes. The member responds back, and this is our conversational agents, those conversational AI dialogues. It says, well, I'd like to, but I can't afford it right now. We say, thanks for letting us know. It sounds like cost may be a challenge. Again, identifying this cost barrier, could be transportation, could be a multitude of issues that come up through these rich dialogues. Person says, yes, it would be great, prayer, tough times, and then we move on to the resources that we can actually connect them with. And this could be a live caller, this could be, through the engagement console or other services here as well. So with that, I think there's some really critical nature about the scale of these dialogues, the amount of data that we actually get back these interactions, and I'll give you a little bit more information about those dialogues in just a second. And so from a scale perspective, mPulse is engaging about 45 million Americans today. 22 million of those are Medicaid members specifically across MCOs and across the states that we're serving. We actively support 13 languages, but can support a multitude of others as necessary. And we'll be delivering probably 350 million digital engagements to support those outcomes and strategies that we had earlier talked about. And so a few things that we've learned about that specifically to Louisiana population that I thought would be really relevant in this discussion. And so the first one is that the populations that are, of course, a higher non-English language preferences that come through, and our platform has the ability to actually listen through those dialogues. And if a member responds back to a communication that went out in English and responds back in Spanish or Tagalog or another language, we then can automatically shift that conversation to the language that was the preference of that member, and then send you that information back to, again, drive much richer conversations. We also see a significantly high number of emojis from your population in the way that they're engaging, and I think that's really fascinating. Strong SMS engagement over other channels, and then the majority, when they do engage, it's actually under an hour from a response rate perspective. And so broader feedback and thumbs up that you'll see is that they appreciate the check-ins, they appreciate the feedback, and that willingness to share. And your market has, again, as mentioned, some challenges around internet access and others, where 31% are dependent on their mobile devices for access to these different services as well. So again, drivers for change. I thought I would share, I thought some of these are fun to see, some of the comments, quotes and emojis that came back from members in a mix here. Some of this is around social isolation programs, checking in on preventive screenings. And so you see here, the person says, no, but I need to be checked. We see in Spanish, gracias por ahora todo bien, which is thank you, so far so good. Related to social isolation, I pray and I listen to music more to pass the time. And those were, fundamentally the three main things that we saw in the social isolation program that we did was people walked more, they prayed more, and they listened to music to reduce stress in those factors for these particular markets. And then, of course, the last is just thank you for looking out for my health, and a multitude of emojis. Hundreds of variations that sometimes I'm not even sure what some of them mean when put together, but our team is actually, of course, with thumbs up and thumbs down, affirmation and negativity, et cetera. But we get some really beautiful insights from listening to the feedback from these consumers. And then as I bring things home, one I wanted to highlight was just our recent Activate 2020 conference, which we had Dr. Gail Christopher as the keynote speaker, focused on health equity and reducing bias. And, she's the chair of the board for the Trust for America's Health, and executive director for the National Collaborative for Health Equity. And these are ways that we help our health plans and our partners really stay educated, stay informed, and really our team, so that we stay connected and really thinking about these particular disparities, how we support these populations as we go forward, because these are the critical things that we need to do to support our partners as well. And so let's go ahead and wrap things up, I think, from a goal perspective. Is I look at the alignment between mPulse's mission objectives and the LDH as well, is really our focus on improving health equity through omni-channel and consumer-first engagement, leveraging engagement capabilities to drive outcomes, and build on SDOH and C&I to drive outcomes as we go forward, and really supported by that healthier people, healthier community strategy. So we look forward to partnering and continue to collaborate. I'll leave this up in summary as we do some questions, but really just appreciate the time and the fact that you all really are on this mission as well and driving this forward. And so thank you for that support. And I'll turn it over to questions.